Welcome to another episode of Aesthetic Revolution, the podcast. I'm Dr. Ed Zimmerman, your host. Staci Taylor Zimmerman, our associate host, and the gal who keeps me going from going down rabbit holes as we talk to you about aesthetic things from forehead to feet, with a concentration somewhat in between sometimes. But our topic today is skin laxity. You know, skin is the largest organ of the body. 100% of the patients who walk through our doors have it. And laxity is an issue. It depends on so many variables. And, you know, it's not just age, orientation, sun exposure, genetic inheritance. There's all kinds of things that go into skin laxity. So Staci happens to be one of the only master estheticians in Southern Nevada. So we're going to pick on her a little bit and her evaluation of skin laxity and what she looks at. And then we're going to talk about the cornucopia of recommendations that we may make to people depending on a whole bunch of variables.
I think this is probably our most common patient, is the patient that comes in with, a little bit of gels starting and someone 40 and over that's starting to see that skin just look more lax. I mean, all over the body, not just on the face.
Well, even younger, and especially for gals who've had babies, pregnancy puts the tissue and skin through a real journey. And there's a lot of laxity where the elasticity that the skin has doesn't fully snap back. And so let's talk a little bit about skin and skin structure. We've got the epidermis on top. So there's 8 to 12 layers of basically dead skin cells, which have a waterproofing action to them so that we don't lose all of our moisture out and we don't get a lot of the bad things in. But those layers are always sloughing off every 30 to 40 days, give or take, depending on the human. And certainly we have lots of people who are exfoliating one way, shape, or form all over their body. Below the epidermis is the papillary dermis. So the dermis is that next layer down. The papillary dermis is on top, has papilla, and the reticular dermis is all kinds of collagen and elastin going different directions. But the basis of your pigment cells and your fine vascular bundles and your nerve endings are all up there in the dermis. And when the epidermis gets scraped away and damage goes past the papillary dermis, then we get scarring. That's visible scarring, sometimes with elevation if it's hypertrophic healing or depression. And we start to see, scars and pock marks and variations in sheen and variations in color and things like that. And, some of it's just wear and tear, and people come in with that stuff. Mm-hmm. So, when they come in, what are some of the things that you're looking at, screening?
Well, I think the first thing I notice is just the quality of their skin, just the color of their skin. So someone who smokes can see that right away. I mean, there's a little bit of a yellow tinge to it. Usually have a lot more wrinkling for their age. That's
so color and texture.
Yeah. That's usually the first thing. It pops out at you.
Irregardless of their Fitzpatrick type, irregardless of whether they're an albino or black, or anywhere in between, we still see the changes.
Right.
So, but the lighter Fitzpatrick skin types, so the Fitz 1-2s like you and the Fitz 3s like me, we don't have enough pigment in our dermal layer to protect us from the UV radiation. So it gets down and it causes more derangement at the DNA level of these skin cells. And they don't repair themselves as easily. So we show age more than someone who is Middle Eastern, African American, Asian, whatever their skin type may be. The darker skin types have an even pigmentation that protects the tissue down below, whereas other people form just freckles, mm-hmm. and others burn and eventually get tan. And it shelters some of the tissue from the UV damage. But UVA and UVB are showering our planet all the time. And every time we go outside or even inside, depending on what film you've got on your windows, you may get exposed to it. Or some people, of course, have tanning beds, which can really concentrate the damage. Mm-hmm. and we see this from forehead to feet, from nose to toes, is this skin damage and laxity, and it's an aging process. And of course, we have to, when we consider laxity, that there's also a volume issue, is that Mother Nature is moving volume around, so we're losing volume in our head balloon. And as we lose volume in the top of our head and our forehead, our skin comes down over our brows. As we lose volume in our cheeks and the fulcrum that our zygomaticus muscles go to raise our corners of our lips, we start to get jowling. And then the platysma muscle falls forward and the skin under the neck just drapes over whatever's underneath of it. So the neck is falling forward as we lose calcium in our mandible and our jaw. This aging stuff it's not for sissies.
It's not. And we also are seeing a lot of weight loss patients.
Yep.
And we're seeing a lot of laxity due to that as well. So
so the GLP-1s of all kinds are a great boon to humankind. And we're getting people down where they're no longer morbidly obese, and we're perhaps decreasing the suffering people have from diabetes, hypertension, orthopedic problems where they're wearing out their joints too quickly. But the skin envelopes are not shrinking down with them, and they're losing muscle mass as part of that. So when you lose your muscle mass, you lose the volume that stretches the skin and makes it look more healthy and more vital. So we have to address those in our aesthetic practice as well.
Right.
So let's talk about, we talk about color, texture, tone, tightness, volume, proportion, contour, and how each of those affects laxity. And we talk a little bit about skin repair. So the skin repair that you can do in your 20s is very different and very much quicker and very much more exuberant than you can do in your 70s. So the technologies and offerings that we have for biostimulators and energy and topicals and things are different with every generation, and it depends on the human as well, because we look at people by their health, not necessarily by their chronological age.
Right. That's very important, because we'll have, two girlfriends come in and they have the same treatment done. One will get a better result than the other, and literally the same energies were used. And this is simply because of the DNA is different.
They have different parents.
They have different parents.
As far as we know.
Right. So that's really important when you're looking for treatments and what type of result you're going to get. Just because your friend got a great result doesn't mean you're going to have as good a result. It's really going to depend on you. And so if you've been a chronic smoker, you've been in the tanning beds or out tanning most of your life, you're not going to get as good a result, because your body's not making collagen and keeping that elastin, just not going to do what it's supposed to do when we try to stimulate it.
Or your diet is different. We certainly see vegans and pescatarians and things like that who don't perhaps all have all of the essential amino acids in their diet on a regular basis, have a harder time responding to our treatments sometimes than others.
And I think we have definitely seen that as well. And I think the collagen supplements, I think that's kind of up in the air. I'm not really sure where the science is. There's a lot of speculation on whether this is true or not, that taking collagen supplements is not as good as if you were to have, a steak.
I prefer my collagen supplements in the form of cow or chicken or fish.
Yes.
And not a synthetic, pre-digested gamish.
Right.
That my tummy's going to do just fine, thank you. It's going to break things down, and the liver's going to make what it needs to out of the amino acids that we absorb. So unless you have an absorption problem, I personally do not, that may not be an issue.
But there are people that are very strict about their diet, and they're not going to eat the meat. And so just so that they're aware, they may not get as good a results as someone else because they don't have some of those, the collagen, the enzymes, the things
the
elastin, to help create that.
Yeah, and we're working at different layers, so you may be able to give them a topical like a Clotho Skin that actually works at a DNA level to improve the telomeres and rejuvenate skin and things like that. And it works different. It works gradually for all ages, but the youthful ones, obviously do well, and that helps repair some of the DNA damage at the surface. But we still have to deal with collagen and elastin production and the fibroseptal network from the underside of the dermis down to the covering of the muscle, that gets stretched as well, and we need to be able to tighten all those things. So we go through a number of things to do that.
Right, and I think that's one of the things that we do at ARLV is we look at the patient as a whole.
We go through these variations with different patients, mothers, daughters, fathers, sons, all those things that all those folks that come in, and their expectations may or may not be realistic. They may or may not be something that we can accomplish. And every patient has a little bit different menu of things that we offer. And we go into the damage that they've had, the damage they've had from sun exposure, whether they are hormonally intact and optimized, whether they're on a good diet. But at the end of the day, when they're coming to you and going, Staci, what do I do about this skin? And you define it as laxity, and you lay out a spectrum of possibilities from something minimally invasive, home program, topicals, coming in next considering potentially superficial to mid-depth chemical peels. They've been around for generations and generations and are pretty well known, and they can be done from forehead to feet. But not everybody wants to go with something as minimally invasive. They want a little bit bigger bang for their buck. And, where do we go next?
Well, we have all the ranges of lasers, and
so lasers, light, ultrasound, electromagnetism, radio frequency. Yeah, we've got a whole barnyard full of technologies.
So let's just take the average one. Let's just male, female. It doesn't matter. In our practice, let's just say they come in, and the thing they're worried the most, what they're seeing is the jowls. They're starting to see the laxity here. We can see it all over in the backs of the hands, the neck, and other places, but they're focused on the jowls. So we would take them through, like you said, their diet, their hormones, and then start to, what's their home care like? And then we start to lay out a plan. And so let's just talk about some of the different things that we do that are non-invasive as far as lasers. And then we can talk about more invasive, and then even surgical options and fillers as well.
Well, I think when we start talking about energy, one of the first questions we ask is, how much are you in the sun?
Right.
How did you get to this point? And how are we going to turn back the clock and keep you from moving back to this point as quickly as you have? And so sun exposure is a big deal. And if people are planning an island vacation 2 weeks from when they're in the office, there's a limitation to the things that we can offer. And like you say, fillers and neuromodulators, so we can reduce dynamic wrinkles. We can put the tissue on stretch by looking at a picture of the patient from earlier in life. If there's proportions and volumes that they like, we can use that as a model, and we can restore the facial proportions, and that will help lift the jowls by treating the face as a suspension bridge, not the kind in Baltimore that falls down, but in a human, they fall down just the same if you hit the right pylon. So if you refill the temples, that lifts the cheeks and gives the Nike swoop back to the cheeks. That lifts the angle of the jawline. And by recontouring the jaw so that you have enough chin height and enough length, that picks up a little bit of the neck here. Overall, it puts everything on stretch. And this can be done very subtle, but the average patient is going to take 1 to 2, occasionally 3 if they're older, but 1 to 2 teaspoons of volume spread throughout the entire facial balloon to reconstitute the 5 to 10 teaspoons of volume loss they've had, depending on their age. From the age of 25, we all lose a half a teaspoon to a teaspoon of volume each year in our skin balloon that sticks on top of our head. So there's a lot of volume loss that certainly contributes to laxity. Then there's the wear and tear of the loss of elastin and collagen, the loss of thickness of the skin, resilience of the skin, elasticity of the skin. So, we need to address that. And, we talked about home program, we've talked about chemical peels. And then there's a whole series of technologies, part of the electromagnetic spectrum, that's individualized for each patient. Right. So if we start with pigmented lesions and vascular lesions as signs of what the UV radiation has done to damage the underlying tissue, we certainly have
your small little blood vessels or flushing rosy cheeks that are there all the time, or what we call liver spots or sunspots that people start to see, sometimes even more predominant on their driver's side. These are some of the things that show the signs of aging and people aren't happy with when they come in. So yes.
Yeah, the red neck or farmer's neck or poikiloderma savat that we see where they have a creamy protected area under the chin, and then as we go down the neck and onto the décolleté, it becomes more and more reddened,
almost purplish sometimes.
Yeah, vascular matting, flat and elevated pigmented lesions, and of course they have to be screened for skin cancers and things like that. But the benign things we can treat with a series of intense pulse light, sometimes called broadband light. So the energy,
or
IPL, intense pulse light. So the energy is from about 600 nanometers up to about 1200 nanometers, and depending on whose technology you're using, there's a sweet spot in the 800 nanometer-ish range. So, that's going to, that energy in the 600 to 800 or maybe 950, well, even 1060 range is going to be absorbed by pigment and vascular lesions. So the hemoglobin in the little vascular ectasia and the pigment, the melanin in the pigment, are going to absorb those energies. And we're going to use particular technologies and parameters to get maximal absorption of the energy into the pathologic colors and protect the surrounding skin by cooling it and just doing a little at a time, so that eventually those unwanted pigments are either being absorbed by the body and shrinking down, or they're being broken down by the body and absorbed and or expelled, sort of lifting to the surface like coffee grounds that come off in the shower over weeks. And a series of those can really rejuvenate the skin from forehead to feet, because we do face, neck, chest, backs of hands, any exposed area. And it feels like a little bit of a rubber band snap, but compared to
feels like a lot.
Well, but it
depends on how much
depends
pigment
on
you
the
have.
human.
If you've got a lot of target there, obviously it's going to be more snappy than someone that has less target.
Yep.
But as you have more treatments, you have less target, so it gets a little bit easier each time. But and
the technology's improved. I mean, you're almost old enough to remember when the photoderm, we used to call it the photo burn, first came out in the 90s, and it was a big pulse of energy. And now we're using energy with the same power behind it, but it's a train of tiny little spikes of energy. So the rest part of the cycle compared to the duty cycle allows the tissue around the element that we're treating not to warm up as much. So we hurt the part that we're trying to hurt to make it go away, and we protect the surrounding tissue, and the snap isn't as bad.
So let me just say something real quick. As I used to be a clinical trainer for some of the major laser companies, you have the latest technology. But I have been in many, many, many hundreds of clinics across the country, and they do not. They have very old technology, or they have technology that's from Alibaba. And it is exactly what you described. So you really, as a patient coming into a practice, need to make sure that people have the latest technology, especially when it comes to IPL, because you can really get hurt by an old IPL that someone doesn't really know how to use properly. So, or
isn't being maintained. You know, we have our equipment checked. So our laser safety officer makes sure that our equipment is putting out the right output and is focusing at the right level. So it's either superficial or deep or in between, and that it's electrically sound. I mean, there's a lot of things going on.
And that your technicians are properly trained.
Yep.
And know laser physics.
Yeah. And tissue interaction and the differences of how you change the variables to make it safer for the patient.
Right.
So we treat the pigmented lesions, we treat the vascular lesions. That doesn't really, whether you use laser or light, address much of the loss of elasticity or collagen in the tissue.
IPL, they say, because of the longer wavelengths, can help to stimulate collagen, but because that energy is spread out throughout all of those wavelengths, it's not the ideal for stimulating collagen.
Yeah, and I think it's just the part of the infrared spectrum that we're absorbing that's heating up the targets, the chromophores. So you're heating up the pigmented lesions, the vascular lesions. A little bit of that heat leaks to the surrounding tissue, and you get a little micro damage that the body repairs a little bit, and so you can quantitatively see a little bit of improvement of the skin, or you turn back the clock a little bit. And certainly in patients that we've done regular IPLs on annually for the past 20 years, their skin looks substantially older than they are than their chronologic age. So, IPL and BBL definitely work when it comes to keeping skin rejuvenated. It's just a matter of staying on top of it. And once you get to your happy place, maintenance, once a year, don't wait for it to get bad again. Mm-hmm. And obviously, protect the skin, keep it out of the sun, that kind of stuff.
And that is another thing that we do address before we kind of go down that road when it comes to lasers or really anything, not anything, because fillers, it's not as important, but if patients aren't going to stay out of the sun or at least protect their sun with a good sunscreen and understand how important that is, there's no point in doing no point in doing an IPL.
I don't think so.
They're really just wasting money, and we try to explain that to them. So, I've had little guys playing golf every day and come in and want us to do IPL on their head. And I said, what sunscreen do you have? I don't use sunscreen. I'm not going to use sunscreen. And
I'm not going to wear a hat.
And I'm not going to wear a hat. I'm not going to change anything I do, but I really want these gone. So it's kind of a uphill battle, and there's no point in doing it. So we just try to,
No, they'll probably find some place to do it, but not usually us.
No, we just don't want to take their money.
Well, we don't want that solar panel for a sex machine out there being a billboard for our practice when it still has brown spots. Yeah. And they don't understand why they come back after they don't do anything to protect the skin. Right. The skin's doing the best it can to protect the underlying tissue. It produces what little islands of pigment it can. But that's the best it can do. Right. So it can't make a nice even glow, and they're stuck with spots.
Right. So we've addressed how we get rid of, vascular lesions and pigmented lesions.
Yep.
So how to stimulate collagen and really get better texture on the skin. Let's talk about some of the ways we do that.
So we have to micro damage the papillary and to some point the upper reticular dermis a little bit. And whether it's with a fractional laser, which could be an ablative fractional laser, like a CO2 laser or an erbium laser, whose energy is absorbed by the water in the tissue, so anything containing water will get microperforations in it, rather than fully ablative. That's a whole nother podcast there. Mm-hmm. We can use ultrasound, so we can focus ultrasound within the first millimeter and a half of depth of the skin. So anywhere on the body, we can use a non-ablative, non-fractional. I say it is fractional, but it isn't causing visible damage to the skin. It's putting little tunnels of energy that you can vector along the lines of tension, the lines of lift in the face or the stomach or the arm or something like that. But you're tightening just the skin with the newest ultrasound devices. Mm-hmm. And there is no downtime. We put topical anesthetic on, sometimes some cold air, occasionally, usually if it's a guy, a little bit of laughing gas. But, these people do really well, and they can do one or a series of those treatments anywhere over the body. And, you need a skilled technician to change the parameters if you're shooting over bone and you're bouncing ultrasound off, so to speak. But, we've gotten some very nice results and some lifting of the vermilion margin back up towards the nose when people have had elongated philtrums, or what I call a duckbill deformity. Mm-hmm. But sometimes they need a little bit more. And certainly as they get older and they don't have a robust response to energy technologies, ultrasound may not be a big enough gun. And so we have variations. Certainly one of those would be a radio frequency microneedling. There's a whole bunch of radio frequency microneedling devices out there that we've used over the years. We have what I think is currently the state of the art with a SAL firm. Mm-hmm. Gives a lot of variability, and it uses a computer-driven engine to push tiny microneedles into the tissue, and then we set a pulse duration and restoration and the pulses of radio frequency that are down in the dermis or can go a little bit deeper, but we can set the levels, we can set the amount of energy that bounces between the little microneedles, and whether they're insulated or not, you get a certain amount of energy that forms a teardrop, if you will, of micro damage that the tissue repairs itself from. minimal downtime. Looks like you went out on the tennis court or the bay and went sailing or the golf or whatever, and you're a little bit red and a little bit microneedled for a few days, but easy enough to do that on a Thursday or Friday, be back at work on Monday and protect your skin, keep it well hydrated and such over the weekend. A little bit of your own platelet-rich plasma can get down through the microperforations, and that's a nice way to help heal the microdamage more quickly and stimulate the healing. Sometimes we use bioactivators, so we'll put a very dilute solution of Radiesse or Belapil just under the skin, very dilute. We're not doing a filler. We're doing a bioactivator to induce collagen and elastin, and those two together work pretty darn nice.
Yeah, we're really liking to do the combination of that and offering that to our patients, and I think that's really a way to step it up.
And then
devices.
Before we would consider surgery, so an upper neck, lower facelift, or some variation thereof, we can put energy in the fiber to contract the fibroseptal networks to pull the skin down closer to the underlying tissue. And we use a helium plasma device called Renuvion. We've got the newest micro hand pieces where we can actually go in the face. We can stimulate a little brow lift. We can pull a little tight under the eye bags. We can pull this jowl up and improve the neck. And even without liposuction, we can put the energy in through little 2-millimeter insertion sites that we can hide in the folds around the ears or the hairline or whatever. And, it's a little bit of a surgical procedure, but not nearly as invasive as one where I'm cutting tissue, moving muscles, coverings, and then cutting off the extra skin and then closing in multiple layers. This one, the insertion sites generally are left open. There's a little bit of tumescing. I do it in the operating room, in our fully accredited operating room. So we keep people floating and comfortable. So lots of things that we can do both above and below to cause improvement of elastin and collagen production, pulling the fibroseptal network in tighter, revolumizing where we need to, and giving an overall improvement in skin texture, tightness, tone, coloration, all those things. Still have to have a person with reasonable expectations. So, sometimes Mother Nature has moved a lot of tissue, or there's been massive weight loss or things like that, and there's just laxity beyond what we can do with minimally invasive procedures, and then we talk about surgery. But it's kind of a fun thing, and there is a lot that we can do with the electromagnetic spectrum and the topicals that we employ and the techniques and technologies that we have available.
Let's talk real quick about these same types of devices on the body and how they differ at all.
Well, we use them from nose to toes. The thinnest skin on the body is probably right under the eyes, and then the thickest skin on the body is probably on the back. And that's why it's the back is problematic when it comes to healing and scarring and hypertrophic healing and stuff like that. Tummies and thighs and arms are somewhere in between. Backs of hands get exposed. And, we certainly have all manner of technology that we use to try to improve things. And we use them, multiple treatments over time. We even have the new, state-of-the-art Pure Impact to be able to try to get muscle hypertrophy to help fill in some of the space where there just isn't fat anymore.
And I always say, people a lot of times don't want to go under the knife. They don't want to have surgery to remove anything. But regardless of lax skin looks better over muscle.
Yep.
So no matter what,
if it's draping over the right contours,
it's still going to look so much better if you've got a nice, tone frame to have a little lax skin over. So, if you don't want to go under the knife, I think, building that muscle is important for sure, and keeping our cores nice and strong. So
restoring the posture.
Right.
So that you don't show the laxity So there's a lot to...
I think sometimes people don't realize, the sunspots, we tend to focus more on the face, but these are, people have a lot of freckles all over their body. We treat with IPL on the backs of the hands, on the chest,
photo body.
On the back. Yeah, we do all of these procedures all over the body. So it's not just the face, it's absolutely the body. And if we have massive weight loss patients, we do a lot of, skin excision too. So you're doing that all the time as well. So
we love jigsaw puzzles.
Yeah.
So yeah, lots of fun ways to address this that people are a little bit unaware of sometimes.
Mm-hmm.
And so a lot of what we do is education, and then we reiterate things to try to help people understand well enough to make an educated decision of what they'd like to do. And the amount of invasivity correlates directly with the result that they get and the duration of the result.
Mm-hmm.
So, once they find out what they want to do and how they want to get there, they may decide to, go ahead and make a bigger commitment, or they may decide not to and just recognize that they can live with what they got.
Right.
And that's okay.
Right. Absolutely.
We're here to educate, and if we can be of service, then, that would be great.
Right. One other thing I just want to mention is, I think sometimes when you go to a practice, they've got just an IPL. And so they're going to try to address everything with just an IPL. And you really want to look for a practice that has more than one tool in the
Sure.
shed. You don't want to have just a hammer. You want to have, a variety. So that's why when they come to our practice, we're looking at everything, and then we're picking what's going to work best for them. And so we have the ability to do that. But some, smaller practitioners don't always have all the choices that we have, but it really kind of does them a little bit of a disservice, because you don't want to, address everything with just one piece of equipment. I mean,
Sure.
One thing can't do everything. You need different tools. So.
Yep. So yeah, and you see that with life and everything. So, it's nice to have been around enough decades, even though I may be a fossil, is that we have had access to a lot of tools over time. We've seen what works. We've participated in the clinical studies, and we continue to learn and replace the older technologies with newer ones that do things more effectively with less risk, more comfort. It's just where the science is going. I mean, it's all about rejuvenative medicine anymore.
And you like a new toy. You like a new
Boys
laser.
with toys.
And I do everything I can to make sure you don't buy things. But you always want the newest, latest.
Last weekend when we traded in 3 pieces of technology that aren't even 10 years old for a new one. But yeah.
But no, we try our best to have the newest, latest technology.
If the science is there to support the purchase.
Yeah. We won't buy it. If science isn't there, we're not buying it. No.
Yeah. We've that could be a whole nother podcast we could do.
All the things that we didn't like.
Yeah. Or that didn't work well, or the few dust collectors where we've had, something that became a doorstop. Everybody's got them. We've been fortunate we haven't had as many of them. But, we've tried hard to make them work. And when they just don't work, we take them out of the line and move on to other things.
Yeah.
So, all right. Well, with that, thanks for listening to another edition of Aesthetic Revolution, the podcast. We've talked a little bit about skin laxity from forehead to feet. It's a droopy topic, but it's something that we address daily. And look, listen, share, ask questions, all that kind of good stuff. We appreciate your tuning in, and we'll look forward to seeing you on the next edition of Aesthetic Revolution, the podcast. Thanks for joining us.